Hello, Dr. PC. I hope you're doing well. In this presentation, I will discuss agenda setting in cognitive behavioral therapy. I will begin by explaining its purpose and the 7 core agenda setting components described by Kennerly and colleagues. I will then critically evaluate 2 counseling demonstrations, reflect on the counseling style I found most effective, explain how I would implement agenda setting in my own practice, and conclude by discussing 3 common challenges associated with agenda setting. Before defining the 7 agenda setting components, it is important to understand why agenda setting is considered a defining feature of CBT. Kennerly and colleagues describe agenda setting as the process of collaboratively establishing a mutually agreed plan at the beginning of each therapy session. Because CBT is a structured and relatively brief therapy, agenda setting ensures that session time is used efficiently while allowing both the counselor and client to prioritize the issues that are most relevant to treatment. Both the counselor and the client are working together, and this encourages the client to become an active participant in the therapeutic process. One of CBT's core assumptions is that meaningful change occurs when counselor and client work together to examine problems, test ideas, and develop practical solutions, thus strengthening the therapeutic alliance. Agenda setting also provides the structure that characterizes CBT and allows counselors to allocate time appropriately while remaining responsive to the unexpected but clinically significant issues. Kennerly and colleagues emphasize that although CBT is structured, the agenda should never be rigid. Instead, it should remain flexible enough to accommodate new concerns as both the counselor and client share responsibility for identifying treatment priorities or changes. As I evaluate the 2 counseling demonstrations in the latter half of this presentation, I will be considering not only whether each agenda component was included, but also how effectively each counselor used the agenda setting to promote collaboration, maintain structure, and facilitate meaningful therapeutic work. The first agenda component is a brief overview of events that have occurred since the previous session. According to Kennerly and colleagues, this review should be concise and should primarily identify concerns that may require further discussion later in the session. Rather than exploring each issue immediately, the counselor works collaboratively with the client to determine whether it should become part of the agenda. For example, a counselor might ask, "What stands out to you about this past week?" Or, "Was there anything that happened this week that you think would be helpful for us to focus on today?" Clients may initially provide lengthy descriptions of everything that happened during the week. However, it's recommended that counselors gently interrupt when appropriate, paraphrasing key points, and check their understanding before deciding whether an issue warrants inclusion on the agenda. This helps preserve valuable session time while honoring client participation. Although this component seems straightforward, it serves as an important function by preventing the session from becoming unfocused. The counselor first gains an overview of the client's week, identifies the most clinically relevant issues, and collaboratively prioritizes them before moving into deeper therapeutic work. The second agenda component involves reviewing what happened in the previous therapy session. This review allows both the counselor and client to consolidate what was learned, clarify any misunderstandings, and identify new insights that may have emerged since the last meeting. A counselor might ask, "What stood out to you after reflecting on last week's session?" Clients may reflect on the previous session through therapy notes, recordings, or personal observations, and these reflections can help shape the current session's agenda. Viewing the previous session also provides an opportunity to assess the client's understanding of the therapeutic work. Counselors should explore whether the client has questions, whether any concepts remain unclear, or whether additional concerns have emerged after reflecting on the previous session. Kennerly and colleagues emphasize that counselors should pay attention to the authenticity of the client's feedback. This means that if a client appears to be agreeing simply to please the counselor rather than expressing genuine thoughts or concerns, the counselor must consider whether addressing this pattern strengthens the therapeutic relationship. If a client cannot recall what occurred during the previous session, this should be viewed as a therapeutic issue to explore rather than simply moving on. Strategies can include reviewing therapy notes or listening to session recordings, which can help improve recall and reinforce learning between sessions. Overall, reviewing the previous session promotes continuity, strengthens collaboration, and helps ensure that therapy builds progressively from one session to the next, rather than treating each meeting as separated and isolated conversations. The third agenda component is the assessment of the client's current mood. This component provides the counselor a glimpse of the client's emotional state before moving into the main therapeutic work. Assessing mood at the beginning of each session allows counselors to monitor changes over time, evaluate treatment progress, and determine whether immediate concerns require attention. For example, after asking the client to rate their mood from 1 to 10, the counselor might follow up with, "What do you think contributed to your mood being a 6 today rather than a 4? Mood assessment can be completed informally by asking clients how they have been feeling, or more formally through standardized measures such as symptom questionnaires or mood rating scales. An example of this would be the Beck Depression Inventory, which I will address later on in this presentation. Comparing these ratings across sessions provides objective information about symptom change and can help determine whether current interventions are effective or whether treatment should be adjusted. This component also serves as an important safety function. If a client reports significant deterioration in mood, increased distress, or indicators of risk, the counselor may need to modify the planned agenda and address these concerns before proceeding further with treatment goals. Although CBT is primarily structured, Kennerly and colleagues note that the agenda should remain flexible enough to accommodate any clinical significant issues as they arise. Overall, routine mood assessment helps counselors monitor progress, make evidence-informed clinical decisions, and ensure that treatment remains responsive to the client's current needs while maintaining the collaborative and structured nature of CBT. The fourth agenda component is reviewing the homework assigned during the previous session. In CBT, homework is considered an essential part of treatment. Reviewing homework can provide an opportunity to solidify the learning, reinforce successful experiences, and identify areas requiring additional support. And this goes beyond simply asking whether homework was completed. And instead, counselors should explore the client's experience with the assignment, discuss what was learned, and examine any barriers that prevented completion. If homework was difficult or incomplete, this should be approached immediately, as well as with curiosity rather than criticism, such as asking, "What worked well?" or "What got in the way while you attempted assignment completion?" This approach allows both the counselor and client to problem solve together and make any adaptations to future assignments. Dobson emphasizes that homework serves as the bridge between what is learned during therapy sessions and how those skills are applied in clients' everyday lives, highlighting that meaningful behavioral change occurs through practicing these CBT strategies beyond the therapy room. Consistent with this perspective, Hoffman and colleagues found that greater homework engagement predicted improved symptom outcomes among individuals receiving CBT for anxiety and depression. With homework review bringing about one of the central principles of CBT, counselors can strengthen clients' confidence, monitor progress, and ensure that interventions continue to support the client's treatment goals. And reviewing this homework promotes active client engagement, therefore supporting the development of lasting cognitive and behavioral change. The fifth agenda component involves collaboratively identifying the session's main topics of discussion. Once the client's week, previous session, current mood, and homework has been reviewed, both parties work together to determine which concerns should become the focus of the session. Dialogue can begin by asking the client, "Given our time today, which of the presenting concerns you mentioned feels most important for us to focus on together?" This process gives space for the client to direct their focus onto the concern of the highest importance for them to tackle. With that said, narrowing in on the issues presented should always be a collective effort because the client's priorities and preferences are just as important as the counselor's clinical judgment and should always be considered. When multiple concerns are brought up, Rather than addressing them within one single session, counselors are encouraged to help the client categorize them in terms of importance. Factors may include the client's level of distress, urgency, risk, and treatment goals should guide this decision. So counselors would want to maximize the likelihood of meaningful progress that can be achieved within the available time. Any additional concerns that cannot be addressed during the current session can be recorded for future appointments. One important note to mention is that agenda setting should never become overly rigid. The counselor should discuss whether the agenda needs to be revised if an unexpected issue of significant importance emerges during the session. Counselors can then maintain both flexibility and structure while preserving the client's active role in treatment when they can collaborate and negotiate these changes. Establishing main discussion topics provides direction for the therapeutic work, followed by ensuring that both parties remain focused on the concerns that are most meaningful and clinically relevant to the client. The sixth agenda component involves developing homework assignment before the session concludes. This component looks forward by planning how the client will continue practicing newly learned skills and maintaining previously learned skills between therapy sessions. Homework assignments should be specific, achievable, and directly connected to the therapeutic work completed during the session. Counselors should clearly explain the purpose of the assignment so that clients understand how practicing these skills contributes to progressive treatment. Counselors should encourage collaboration by inviting questions, discussing the client's confidence in completing the task, and identifying potential obstacles before the session ends. If barriers are anticipated, both parties can work together to modify the assignment or develop further strategies to increase the likelihood of success. Collaborative planning helps reduce frustration and promotes clarity, as well as greater adherence to homework between sessions. One point that stood out to me from Kennerly and colleagues was that homework should never be viewed as something a client can simply pass or fail. Instead, every homework assignment should generate useful information for therapy, even if the client is unable to complete the task as intended. Therefore, the experience can still reveal important thoughts, emotions, behaviors, or barriers that guide future treatment. The seventh and final agenda component is obtaining feedback before concluding the session. According to Kennerly and colleagues, counselors should routinely invite clients to reflect on their experience of the session, discuss what they found helpful, and identify any remaining questions or concerns. Seeking feedback reinforces honesty, openness, and collaboration by recognizing the client as an active partner in the therapeutic process. Supporting the importance of client feedback, Okamoto and Kazantzis explained that collaboration, empathy, mutually agreed upon goals, and ongoing feedback are fundamental components of the therapeutic relationship in CBT, helping counselors identify and repair difficulties before they interfere with treatment. Feedback also allows the counselor to determine whether the client accurately understood the concepts discussed during the session. Any misunderstandings, unanswered questions, or unresolved concerns that are identified can be clarified immediately or incorporated into the agenda for future sessions so that they can reduce the likelihood that important issues remain unaddressed. Some clients may not feel comfortable or may feel hesitant to express dissatisfaction, maybe due to wanting to avoid perceived conflict. Therefore, it's important that counselors create a safe and respectful environment for open communication. Counselors can identify potential alliance ruptures, adapt their approach when necessary, and strengthen the therapeutic relationship. It is imperative that both parties share an understanding of the session's progress and how this information can be useful to guide future therapeutic work. After reviewing the 7 agenda setting components outlined by Kennerly and colleagues, I will now examine how Grande's and Quelia's counseling demonstrations implemented these components, in which all 7 were incorporated, but they differed in how they delivered them. Both counselors began by reviewing the client's recent experiences. However, they approached this task differently in the Grande demonstration. The client introduced several concerns, including difficulties at work with her supervisor, challenges related to school, uncertainty about her relationship with her boyfriend, and questions surrounding marriage. Grande assessed mood conversationally by asking the client about the difficulties she had experienced since the previous session. This conversational approach helped establish rapport and encourage client participation. However, it did provide less objective information on symptoms, severity, or treatment progress. Rather than attempting to address every concern immediately, the counselor listened carefully and worked collaboratively with the client to determine which issue should become the primary focus of the session. Ultimately, they agreed to prioritize school because the client identified it as her most immediate source of distress, which demonstrated a collaborative agenda setting while maintaining flexibility. In comparison, the Qualia counselor followed a more structured sequence early in the session. The counselor reviewed the client's functioning since the previous session, completed a mood assessment using both a subjective mood rating and the BDI, and also asked the client to rate their current mood on a 1 to 10 scale. With the client reporting a 6 today and approximately a 5 throughout the previous week. Qualia also wrote the agreed upon agenda on a whiteboard, which made the session structure explicit and allowed both counselor and client to refer back to the agenda throughout the discussion. Another difference involved homework. In the Grande demonstration, homework was discussed as a part of the ongoing conversation and connected to the client's identified priorities, including improving eating habits, sleep, and academic functioning. In contrast, the Qualia counselor conducted a more systematic review by introducing new material and concluded the session by collaboratively developing a behavioral activation assignment that was directly linked to the client's depressive symptoms. This is demonstrated when the counselor asked the client to schedule and complete an activity schedule before the next session, explaining how increasing engagement in rewarding behaviors could improve mood and reduce depressive symptoms. Both counselors also encourage collaboration throughout the session, but they demonstrated in different ways as well. Grande frequently checked whether the client agreed with the direction of the discussion before moving forward, creating a more natural conversational style. However, Qualia maintained collaboration through structure by explaining each stage of the session, inviting the client's input, and understanding when establishing the agenda before assigning homework. I also appreciated that the counselor explicitly encouraged feedback through statements such as, "We're in this together," and "We're a team," as this helps validate the client's experience. One way I did appreciate Grande's approach is how he explored the client's difficulties in a holistic manner, by how the difficulties of school were interconnected with sleep, eating habits, and overall functioning, which reflects CBT's emphasis on the relationship between thoughts, emotions, behaviors, and physiology. Overall, both demonstrations reflected the collaborative principles of CBT. However, Qualia's use of standardized mood measures, written agenda setting, and systematic homework reviewed aligned a bit more closely with the structured agenda setting framework described by Kennerly and colleagues, whereas Grande demonstrated how the CBT principles can be implemented in a more flexible conversational manner. Although both demonstrations reflected effective CBT, I found myself referring to the counseling style demonstrated by Qualia. One of the primary reasons for this preference was the counselor's ability to balance structure with collaboration rather than allowing the conversation to develop organically. The counselor clearly explained each stage of the session, collectively established the agenda, and frequently summarized the client's responses. I believe this level of organization provides clients with a clearer understanding of the therapeutic process while still allowing them to actively participate in decision-making. I also appreciated the use of objective assessment throughout the session. For example, the counselor administered the BDI, they discussed the client's score of 25 and asked the client to write their mood on a scale from 1 to 10. Write their mood? It's okay. Comparing this with the previous week, the standardized measures complemented the clinical conversation by providing measurable indicators of symptoms, severity, and treatment progress. Rather than relying solely on objective impressions, the counselor combined quantitative information with collaborative discussion to guide treatment planning. Another aspect that stood out to me was how each intervention was purposely connected to the client's presenting concerns after reviewing the client's low points during the week. The counselor explained how behavioral activation could interrupt the depressive cycle and developed an activity schedule as homework. This demonstrated a logical progression from assessment to intervention, allowing the client to understand why each component of treatment was being introduced. This counseling style aligns closely with how I envision my own practice. I value structure because it promotes organization and efficient use of session time and consistency across treatment. At the same time, however, I can appreciate how Grande led with a comfortable, warm conversational demeanor, which helped create a comfortable therapeutic environment. His natural and formal delivery appeared to foster rapport and personability with the client, while encouraging the client to openly discuss multiple concerns. I did appreciate how Qualia established rapport by making the therapeutic process transparent and frequently summarizing the client's responses, which allows for the client to feel heard and understood, like I said a little bit earlier. Ideally, I would strive to integrate Qualia's structured approach with Grande's personable and engaging therapeutic presence. Based on both demonstrations, I would implement an agenda by combining a structured CBT framework with a warm collaborative therapeutic style. At the beginning of each session, I might begin by saying, before we decide on what to focus on today, let's briefly review how things have been since we last met and whether anything new has come up. To establish an agenda by reviewing the previous week and discussing the previous session. Next, I would assess their current mood and review homework. Rather than treating the agenda setting as a rigid checklist, I would use it as a flexible guide that helps ensure important concerns are addressed while remaining responsive to the client's immediate needs. This approach is supported by Hernandez, and Waller, who found that clinicians would actively discuss the rationale for CBT techniques and plan treatment collaboratively with clients rather than assuming what the client needs or values most in therapy. I would also incorporate routine mood monitoring throughout treatment for clients presenting with depression or anxiety. I believe standardized measures such as symptom questionnaires or mood rating scales will provide valuable information about treatment progress alongside listening to and considering the client's own experiences. Some examples of collaborative questioning would be, which areas are interfering with your functioning the most? Or which concern would be most helpful for us to focus on today? To ensure the agenda reflects both the client's priorities and my clinical judgment in the near future. And similar to the Qualia demonstration, I would ensure that homework assignments are collaboratively developed, clearly explained, and directly linked to the goals established during the session. Before concluding the session, I would discuss any potential barriers to completing the homework as well as problem-solving ways to increase the likelihood of success. I would also ensure that all homework assignments are written down by both myself and the client and routinely reviewed at the beginning of the following session. Consistently reviewing homework reinforces it as an integral part of the therapeutic process rather than an optional activity. Finally, I would end each session by inviting honest client feedback regarding both the therapeutic process and the session itself. Asking, before we finish today, is there anything that you didn't feel helpful or that you'd like us to do differently next session can open the scope of communication and perhaps make the client more comfortable to give their honest opinion. I would encourage clients to voice questions or concerns by emphasizing that therapy is a mutual process and that we are always working as a team. I believe routinely seeking feedback strengthens the therapeutic alliance, promotes client engagement, and allows treatment to be adjusted when necessary. Although agenda setting in CBT provides structure and direction, counselors may encounter challenges that interfere with effective implementation. Kennerly and colleagues stress that agenda setting is more than just simply creating a list of discussion topics. When agenda setting is implemented poorly, it can reduce collaboration as well as disrupt the flow of the session. In this presentation, I've selected 3 common agenda setting difficulties discussed in the textbook, which are presented as putting too many items on the agenda, not obtaining genuine client input, and tackling issues prematurely. These challenges stood out to me because they each have the potential to affect the therapeutic alliance, reduce the efficiency of the session, and interfere with collective decision-making. One common difficulty in agenda setting is attempting to address too many concerns within a single session. Clients will often arrive with multiple problems they would like to discuss, and counselors may feel pressured to address each concern. However, Kennerly and colleagues caution that including too many agenda items can reduce the depth of the therapeutic work and make the session feel rushed. That is why it is important to work together with the client to prioritize concerns based on urgency, levels of distress, and relevance to treatment goals. And like I said earlier, any topics that cannot be fully addressed within the available time will be acknowledged and scheduled for future sessions. The Grande demonstration illustrated the strategy well, as the client presented concerns related to work in her relationship. The counselor clarified with the client on which issue had the greatest impact on the client's functioning, and then prioritized that as the primary focus. This allowed sufficient time for meaningful intervention, while reassuring to the client that her remaining concerns are not to be ignored. Another challenge occurs when clients do not feel like they can provide genuine input during agenda setting. Some of them may agree with the counselor's suggestions simply to be polite or avoid conflict, or because they believe the counselor knows best. As a result, the agenda may not accurately reflect the client's priorities. Kennerly and colleagues state that that agenda setting should remain a collective task where clients should feel comfortable expressing disagreement, asking questions, and suggesting topics that are important to them. In practice, I would avoid assuming that silence or agreement means the client is comfortable with the agenda. Instead, I would ask questions such as, does this agenda reflect what you were hoping we would discuss today? Or would you like to spend more time on another concern? Creating these opportunities for genuine input does help ensure that the agenda reflects the client's priorities rather than the counselor's assumptions. The third difficulty involves tackling issues prematurely. Before the agenda has been fully established, counselors may feel tempted to immediately begin solving the first problem. However, doing so may overwhelm the client, particularly when the concern appears emotionally significant. The key is to acknowledge other important issues to be identified and not to disrupt the structure of the session. Completing the agenda setting process before moving into detailed intervention allows both the counselor and client to gain an overview of the client's concerns, and then together they can determine which issue should become the primary focus. Similarly, Kennerly and colleagues advise that counselors avoid attempting to modify deeper underlying beliefs before clients have developed sufficient CBT skills and a shared understanding of the formulation. Practical problem solving and skill development should remain the focus before progressing to more complex cognitive work. And both demonstrations did illustrate this principle. Grande listened to several presenting concerns before deciding to focus on school, while Quayle completed mood assessment, review previous session, gathered feedback, and established the written agenda before introducing behavioral activation. In my future practice, I would remind myself that effective agenda setting is an investment in the quality of the session. Spending a few minutes developing a clear agenda at the beginning of therapy is likely to result in more focused interventions and a more meaningful therapeutic session. Concluding this presentation, some key takeaways in agenda setting include providing structure while remaining flexible, collaboration between counselor and client, which is essential throughout CBT, and effective agenda setting promotes meaningful therapeutic change through. Oh, I forgot to edit it on the PowerPoint. Sorry. The commas are not in the correct place. Effective agenda setting promotes meaningful therapeutic change through focused discussion, homework, and ongoing feedback. Ultimately, effective CBT agenda setting is not about rigidly following a checklist. It's about having a purpose, a goal or set of goals that are clearly articulated while maintaining a collective effort and creating a flexible structure that promotes the well-being of the client so that they can benefit from meaningful therapeutic work and successfully apply it to their everyday lives. Thank you so much. I have no idea what time I'm at, and I'm hoping it's under 30 minutes. Have a lovely rest of your summer. Dr. PC references, and that group agreement will be sent separately. Okie dokie.